I would like to welcome you for selecting this course today. Hopefully you will find this extremely rewarding and interesting and something that you can actually bring back into your practice. Many of us in the practice of dentistry are aware of vitamin D, but at this point in time it may be misunderstood its role in dentistry, may be underappreciated, and probably underused in our treatment of our patients in our daily practice. I'm presently the Associate Dean of Postgraduate Programs and a Professor of Clinical Dentistry at Columbia University. So once again, I look forward to spending this time with you going over vitamin D. Our goals and objectives for this particular course. It's to help you identify the signs of vitamin D deficiency and recommended treatments in your patient. Also, to be able to discuss the possible relationships between vitamin D and systemic disease. And this is playing a larger role, as we all know, as periodontal diseases in our patients also have relationship with systemic diseases. Also to explain the role of vitamin D in relationship to periodontal disease. And 1 billion people worldwide have vitamin D deficiency. Well, that probably means in your practice, 40 to 50% of your patients can be vitamin D deficient. This is an important practice management consideration. I talked to you about it can be looked at as an environmental risk factor, or it could be looked at from a genetic gene risk factor. So it's basically you're going to plug it into both areas, thereby having a role in regulation of cell proliferation, differentiation, cell death or apoptosis, and angiogenesis, which is quite important, the growth of blood vessels in different areas in wound healing. You always thought of the key organ affected by vitamin D as being skeletal. However, it affects most organ systems, especially the cardiovascular organ systems, muscle, brain, and our immune system, as we've been talking about. Statins may actually increase the levels of vitamin D. Anything that affects the bone metabolism for positive or negative, and various drugs and the angiogenesis in a particular area will have an effect on the wound healing in the area and bone health. Thank you.